Jayashree and the Brindavan Education Trust for reaching out to me for a session on, handling the nutritional concerns in children with special needs. So my presentation, is my screen visible?
Yeah.
Yeah. So to begin with, I will just start with a little bit of background about special children. This is just to tell and give you the statistics as to how many children across the world are actually needing a little support. If the caregivers, the teachers, and the most important, the parents and the family are supporting them, these concerns can be handled very well, and the patient's the student's nutritional status can be maintained. So if the nutritional status is well maintained, they are able to overcome the learning challenges that they generally face. So it's just, they are so special, they have special needs. That's it. It is as simple as that. The hand-holding that they need from the family, from the teachers, if they get that, if they're able to overcome the nutritional challenges that they have, they are able to eat better, they are going to, have a normal life like any other children. And as Ms. Rekha was just sharing about the support group, so these support groups that are formed to help these children are actually doing a lot of good because there is somebody who's able to listen to the concerns that they have. So I would suggest that if somebody is needing help in, anything, it can be nutrition related issues or occupational therapy, anything, be very regular in reaching out to the organizations like this and gain the benefit and help your child. So to begin with my presentation, so there's a little bit of insight that I'm going to give. So we all are aware what who are the children that who are falling into this category of special needs. It's a broader term. It refers to children who are needing additional support due to physiological, emotional, behavioral, developmental, and learning concerns that they have. I wouldn't even call it as differences. They require specialized approach to education, care, and inclusion. So the types of special needs that they need are in the developmental issues, the learning disabilities that they have, the physiological disabilities they have. They can have emotional and behavioral disorders, and also they can have some medical needs. So developmental disabilities, all these issues, like autism, and Down syndrome, intellectual disabilities fall into this category. And those who are, slow learners, I would like to call it as slow learners, like dyslexia, and understanding math is a little difficult. Writing is something they don't appreciate it much. They fall into this category. And coming to the physical disabilities, anybody with cerebral palsy, muscular dystrophy, spina bifida, and visual or hearing impairment. And then comes the emotional and behavioral disorders. When I tell ADHD, it is not only in children, ADHD is seen in adults also. So, whenever somebody is assessing and saying that you need help, we should not shy away from that. If adults have started understanding and they are ready to take help, then definitely it will become very easy for the children. So the kind of lifestyle that we are following, the kind of, you know, complications like mental pressure and stress that we are undergoing in our day-to-day life is actually leading to these kind of issues like ADHD, anxiety disorders, and then oppositional defiant disorders, these kind of things. Earlier, we didn't have a terminology to explain all this, but then due to the advancement in science, and then there are a lot of assessment tools that have been introduced, and because of that we are able to address these issues. So if it is needed, have it evaluated and address it so that the quality of life gets better, whether it is for adults or whether it is for children. Then comes medical needs, epilepsy, cystic fibrosis, and diabetes, especially type 1 diabetes in children. So a little bit of hand holding and guidance will actually help them. So this is something about the prevalence of special children. I just wanted to highlight this to say that.
Thank you,
So
mother.
to say that there are many children globally and in India who are needing this support, and with this support, they are able to lead a normal life. So, approximately around 240 million children worldwide live with some disability. It can be anything that I have just listed out in my previous slide, and it is representing about 10% of the global child population. Therefore, globally, 10% of the children are needing some support. And according to the 2011 census, around 78.6 lakh children are with disabilities between the age category 0 to 19 years in India too. So the level of concerns that they have is different. So with a little bit of hand holding and by assessing their needs and the support that we can offer and the support that the parents take from the organizations like Brindavan is actually helping children overcome their issues that they have, and it will help them to lead a normal life. This is another slide which is actually telling us how much of autism is existing globally. It's nothing like it is just there in my family or your family. It is there in India, it is there globally also. So, and this slide is actually giving a little bit more information about different countries, how many children are there. In India, we have around 715, children per 1 lakh children, the population. So in 1 lakh children, around 715 children are, diagnosed to be having autism. So if it is diagnosed early, and if the support that the child is needing and the family is needing and the parents are needing, if it is offered, it will be really good for the children to cope up with these additional needs. Then coming to the number of, boys and girls who are getting into this. When it is, autism, it is the number of boys, exhibiting autism is more compared to the girls. And what is autism? It's just a development disability. And children, it's just that children are locked within themselves. They are so much self-centered. They are just, in their own world. It is a very simple way of, explaining what autism is. Then coming to why it is called as spectrum, because the term spectrum in autism refers to the wide range of symptoms and severity. This is what I was telling. So when some child is having some kind of a concern, he is needing some help, it need not be that all children are needing this much of support. The severity differs, the symptoms differ. Therefore, it is very important that the parents observe the children
बटन
and
होके देख लेना
they are
बटन
observing the
देख
milestones in the children to ensure that support needed, it is attended to immediately. So the definition is autism spectrum disorder is a condition related to brain development that impacts how a children, how a person, how a child perceives and socializes with others, because it is causing issues with social interaction and communication. The disorder includes limited and repetitive patterns of behavior. So this is again, something called as ADHD. I was telling that this is not only found in children, it is there in adults also. It is attention deficit hyperactivity disorder. This can be, there can be various, reasons why, children land up with this or adults land up with this. And the symptoms that they exhibit are different. They can be learning issues, they can be anxiety, they can be increased injuries because they don't focus on what is there next to them, and they are just in their own world. They're just walking and doing activities like the way they want. And they can be behavioral issues, and this can be because of some issues related to the central nervous system, or it can be the environmental behaviors, or it can be genetic reasons, or it can be neurological issues that they land up with. So age of emergence, there's nothing like an age. So this generally when it is something like behavioral disorders. Children generally exhibit this at a very young age. Therefore, it is very important that parents are, observing the children, and if at all they need help, they should not shy away, and they should, reach out to the relevant people who can help them out with this. And a small number of children appear to develop normally in the initial first year, and as they grow up, due to various reasons, they can exhibit this at, at 18 years to 24 months, 18 months to 24 months of age. So the signs, what are the signs that the parents can observe is the social communication that is getting affected, and it can be the language that can, the child is not learning, though it is the mother tongue, or it can be the verbal and non-verbal communication they are not able to catch. They can be social interactions that are getting affected, difficulty in recognizing or understanding the other people's emotions and feelings. Then comes the social imagination, difficulty in understanding and predicting the other people's behavior. These are the signs and symptoms that the parents can catch and address it with the pediatrician. And if it is referred, if they are referred to this kind of educational institutions, please do reach out on time and then gain the benefit in giving a normal life to the child to cope up with all these issues that they are facing. When it comes to social communication and interaction, we see all this in children. So these, signs are indicating that the child needs help. Therefore, immediately reaching out is the solution. So the child fails to respond when you call the name and you're trying to talk to them, they don't respond. They resist cuddling. There's poor eye contact when you're trying to talk. They can't start a conversation immediately. They speak abnormally, and the rhythm in which they speak is different. And they use a lot of, repetitive words, and they are used to using those words whenever, it can be irrelevant also many a times. And they have difficulty in recognizing non-verbal cues, such as interpreting other people's facial expressions. They become more confused. They don't know how to react at that moment. If this is persisting and this is, there for a longer duration, then the child needs evaluation. Then comes pattern of behavior. This is what I have, discussed in the previous slide also. They perform activities that could cause self-harm many a times, such as biting or, banging the head and things. And they are very rigid, and they become, really unmanageable many a times. These kind of, behaviors have to be attended to immediately to ensure the child is safe, and then you're able to help the child overcome this. So the additional signs are they have sensory sensitivities. They experience sensory experiences very strongly, so that, for example, bright lights, loud noises, and certain smells and tastes, the feel of certain fabric may also be distressing to them. So if they start liking something, they are very comfortable with that. They insist that they want that to be given to them all the time. They might refuse some food items. They don't want that, means they don't want. The very sight of it can actually make them really, behave in a manner that parents and teachers are not able to handle them. So they are very, very, particular about things. So they want it in some manner, and they ensure that they get it at any cost. So what are the causes? It can be genetic, it can be environmental factors, or it can be, a child with a special need is already there at home. That can also be one of the reasons, and it can be genetic, or it can be the behavior that the child is, getting adapted to. So, what are the risk factors? It can be the child's gender, it can be the family history, or the other disorders. It can be the family environment in the household, which is actually, leading to this kind of a behavior. Or they can be extremely preterm babies, or it can be the parents' age. When children are born to the parents when they are really old, is actually exposing the child to these kind of, disorders. So boys are about 4 times more likely to develop autism spectrum disorder than girls. This I've already discussed. And family history, again, I have already mentioned that this is if somebody is there in the family or if they have family history, they are more exposed to it. And the other children is, the other disorders, or it can be the family environment or the other medical conditions that they have. The medications that are given is causing the child to exhibit these kind of behaviors. And extremely preterm babies, when they are born at 26 weeks of gestation, when they are still not in a position to come to the world, and then start having the growth milestones in comparison to the child who's born at 36 to 40 weeks, these kind of issues are there. And the parents age, I have already mentioned about this. What we might notice in a child with autism, this also I've already discussed. So, when to see the doctor? When the child doesn't respond with a smile or happy expressions by 6 months and doesn't mimic sounds or facial expressions by 9 months, doesn't you know have a doesn't recognize people at home as family members and doesn't have a gesture such as a point or a wave by 14 months, doesn't say single words by 16 months. These are the behaviors that, these are the points that have to be taken into consideration. Meet the doctor and the therapist as recommended by the doctor. The complications are problems with social interaction, communication, and behavior can lead to a lot of learning issues, problems in the school, and whatever examination pattern the schools have, whether they like it or not, they have to follow it, and they might not be able to perform to the level that is expected to. There can be employment problems, inability to live independently. There can be social isolation that they experience. There can be stress within the family because the child is not getting adequate affection and inclusion in the society. And victimization and being bullied is something that is bothering the family and the parents. So the nutritional concerns, see, this is something, a little bit of background about what happens and what are the signs and what kind of children can fall into this category, and what are the reasons because of which this can happen, and if something can be addressed in a proper manner to prevent this, that can be done. That is why we've understood the risk factors. But then there are a lot of nutritional concerns that happen. It can be because of the rigid behavior that they have, or it can be the sensory sensitivities that we just discussed. Children become very picky, and that is actually interfering with a lot of growth and developmental things that has to happen at the right time, might not happen. So they have delayed milestones, and that can actually lead to a lot of a drop in self confidence too. So even though the child is able to cope up with a lot of these behavioral issues that they develop through occupational therapy and things, when nutritionally they are not sound, they don't have that stamina, and energy in comparison to the same child of the same age and things, that will actually deplete the confidence and things to face the community, to face the same age category of people when they gather. Therefore, it is very important that we are able to address these concerns. So there is picky eating, there's rigidity and routine. They want the same kind of food on a daily basis. There are sensory issues. If they don't like something, they don't even want to taste. This is what we've discussed. So therefore,
Right.
these
So
this kind of
go on YouTube.
behavior. So you want me to stop? Is there anything in Ms. Jayashree?
No, no, no. I think I'm just muting them. Yeah.
Sure, sure. Yeah. So children who are having these kind of erratic eating pattern due to impulsivity or side effects because of the medications that have been started to ensure that their hyperactivity is under control or their learning, capabilities get better, is actually leading to a lot of issues like deficiencies of micronutrients. It can be omega-3 fatty acid, it can be iron deficiency, it can be hemoglobin going down, it can be magnesium deficiency, it can be zinc deficiency. So, to cope up with this, it is very important that the support group activities that are organized are attended periodically to ensure that these issues are addressed immediately. For it to be addressed, it has to be evaluated at the right time. And these children who are exhibiting behavioral issues, or it can be hyperactivity, they actually crave a lot of sugar and processed food, because this is what is giving them energy. The more sugar and processed food is given into the diet, they are more hyperactive, and anything that is uncooked, anything that is like a fruit or a salad, they generally don't appreciate that, because it takes a little time for the body to digest and assimilate and provide energy. They without knowing the reason why they have a craving for sugar and processed food, they generally opt for this kind of food because it is giving them instant energy, and they're able to have that kind of an activity which they are used to. And the artificial food items, it can be the food colors that they use in the food to prepare and make it more attractive, especially the outside food, and the preservatives that are added to the food, which is increasing the shelf life, might be giving this hyperactivity in most of the children. So it can be that hyperactivity is something that they are developing over a period of time because of the kind of food habits that they have, because of the lifestyle that they have. Currently, the trend is the screen time is increasing, the physical activity levels are much less in children, and the increase in sugar and processed food is something which is causing a lot of hyperactivity in children. So if we encourage them to be more active, reduce screen time, or it can be limit screen time would be the right way of putting it across, and introducing a lot of fruits and vegetables, like how the food pattern was at least 2 decades back, that will address a lot of hyperactivity issues. And that's a nice thing. So if there are other medical related to medical related disorders and disabilities, those things can be managed with the help of the doctors and things. But when it is something like a hyperactivity, which is the reason is food and lifestyle, if that can be changed, and if that is something which is addressed at the right age, these intolerances and allergies that we are generally coming across in children, that also will be very much less. Children with special needs are more prone for food allergies, and it is more prominent in comparison to the normal children. So allergies can cause physiological symptoms. It can be diarrhea, vomiting, it can be some skin rashes and things, it can be wheezing, and this should not be taken lightly. It should be addressed immediately. And there can be, issues like trouble communicating with others. The child is unable to communicate that it is actually causing an issue. There can be a lot of discomfort and pain that the child is experiencing, and he's not able to address it. Therefore, parents and teachers and caregivers have to really be more observant, and catch the symptoms, because the child is not able to express it. And the nutritional concerns that I just discussed in my previous slide, they can be diarrhea, vomiting, and things. In some children, they can be constipation also. Because of the kind of food they are eating, there can be constipation because it lacks fiber in the food, like, fruits and vegetables are not there. That is because of picky eating, that is because of the sensory, issues that they are undergoing. They get into the comfort zone that they want only this particular food, which is actually keeping them comfortable. They are not able to express why they like that food. So it's very important that a cyclic menu kind of a thing is maintained at home, and the mother or the other family members are observing how the child is accepting it, whether they like it or not. When they consume, how is the stool, how is the stool frequency, how is the consistency, how is the behavior of the child, how is the learning disability, the learning ability, and if there is any disability, what food is causing is something that we can arrive at. So they can be chronic diarrhea, they can be chronic constipation, there can be gastroesophageal reflex disease. That is, the child is complaining that there is, some throat discomfort on eating. We will just say that, there's nothing, you don't have to worry, it will settle in some time and things, is what we tell, and we pacify them. So definitely it has to be addressed and observe whether, what he had eaten, and whether the same food, when he is eating repeatedly, whether it is, causing this gastric reflux. And there are a lot of research reports that say that GI activity of some children with autism differs from the other children. It need not be. That is what I said. Each child is different, and the children can exhibit different symptoms. The intestinal cells show abnormalities in how they break down and transport carbohydrates. So when this, these abnormalities can be different. Therefore, the level and the severity and the intolerance to the particular food can be different in different children. So it has to be, every individual child has to be considered as a case by itself. So the intestines are home to abnormal amount of certain digestive bacteria. It can be the inability to digest that particular food, or the digestive bacteria that is present in that particular child is not agreeing to the kind of carbohydrate that we are giving. All that needs to be assessed. And the solutions are to the parents and the caregivers: when they are exhibiting picky eating, stay calm and be patient with the child. Take steps towards tasting. You can actually taste it and tell that I'm fine, nothing is going to happen, just give it a try. And tune into textures. If they don't want it in the fruit form, give it in the juice form. If they don't like it in the liquid form, convert it into something that they like, and then try to offer it in different forms. And so that the child gets accustomed to that particular food, play with that food, so that the child will, start liking and appreciating the colors. When the child is saying no, probably he's not even looking at that particular food. He's not focusing on the color and the shape of the food. So, first, it is very important that he gets accustomed. He's appreciating the colors, he's appreciating the shape, and therefore, he's developing that, connect with the food, saying that this is also meant to be eaten. I will give it a try. That is why it is needed that the food is given into his hand and observe how he is going to deal with it. This is what I'm trying to tell when I say play with new food. Offer choices and control. So whenever the child is refusing something and asking for something else, two, three kind of food items have to be offered, and then say that out of these three, you're going to choose one. And how much he is going to drink or eat, that also has to be decided, and to ensure that he is not going overboard. Because generally, when it comes to processed food and anything that contains a lot of sugar, children there do not limit it. There's no limit to the quantity that they consume, and one meal of lot of sugar containing food and processed food can spoil the whole day of the child who's battling hyperactivity disorder. Therefore, it's very important that there's a check on the quantity also. And be careful with the rewards. So we should, when the parents and the caregivers are offering rewards, it should not always be that if you eat this, you're going to get this. It should be like, if you eat this, going to get this activity. If you eat this, you're going to get this in terms of something else as an activity, but not definitely like an item or something that they are wanting to have it for themselves. So it's very important that very tactfully these children are managed, to ensure that they are eating and they are able to take care of themselves, and they are not always doing this for the rewards that they want. Then comes, so when I said that the children are picky eaters, and because of which they are landing up with a lot of deficiencies, it can be like the body is not having any abnormality to digest that particular food. It can just be the rigidity that the child has developed towards that particular food. It can be the aversion, it can be the self imposed food restriction, It is because the child is so rigid, he wants to show that rigidity by not eating whatever is offered to him. Or he is not liking the texture, he's not liking the color, he's not liking the feeling on eating that particular food. There might not be any physiological issue in digesting the food. So, in such children, it is very important that periodically health checks are done, the micronutrient status is checked, and then whatever deficiencies are there that have to be corrected. Because there are a lot of food, food items like, non-veg and fish and eggs and things, which is actually providing a lot of good nutrition in terms of essential fatty acids like omega 3 fatty acids. All these are most of the times related to the cognitive behavior of the children and the learning abilities of the children. It might appear as one of the nutrient, but when a child is deprived of omega 3 fatty acids, might be the child becomes a slow learner. So it's very important that in the initial months, the mother and the family members are observing the child's behavior, and if at all it is needed, it has to be addressed with the help of a pediatrician to ensure that whatever deficiencies are there, it is corrected periodically so that it doesn't lead to the level of any kind of a disorder in the child. Then comes probiotics. So the reason why I'm focusing on multivitamins and probiotics is when children are, rigid and they want something which contains a lot of sugar, and it is contained, and anything that contains a lot of, fat in the form of processed food, they are able to get that energy, whatever they want for them to be active the whole day. The worst hit are the micronutrients. So the children are managing to get energy, but the micronutrient status, that is the vitamins and mineral status, the protein status, is something that suffers a lot. And also the most important thing is fiber. Fiber is the most beneficial part of the food that we consume, because that is taking care of a lot of functions in our body. Like, it is helping the food digest, it is helping the waste get excreted, because this fiber is the thing which, gets converted into a gel, and it helps in removing all the waste from the body. So in scientific language, we say that it adds bulk to the stool. So when this bulk is lacking, the child is facing a lot of issues with defecation. That is why constipation becomes a very common problem in these children who are only wanting to eat that anything that contains sugar and fat, and they don't like most of the food items that contain fiber. So all this fiber containing foods, that is the fruits and vegetables, are packed with micronutrients. When they don't take this, it's very obvious that children will end up with these deficiencies. Then comes probiotics. See, probiotics are, the food for the good bacteria that is present in our intestine. So when we feed with probiotics, and there's something called as prebiotics. Prebiotics come from the fiber that we eat. Fiber is, giving feed to the good bacteria that is present. Prebiotic is the food that is actually helping the organisms survive. So when there's no fiber, these this beneficial bacteria don't survive. And whatever benefits that we get from these good bacteria in terms of maintaining the intestinal health, that lacks in these children, and that is why they actually exhibit behavioral changes. So there is something called as the gut brain axis, which is, which has to be maintained. So I'm going to talk about that in my future slides. So the nutritional deficiencies, all this, which are addressed, have to be, you know, repeatedly being, there should be a follow up. So if some therapy has been started by the pediatrician, it should be like every 6 months or every 1 year, the multivitamin, have multivitamin status has to be checked and see whether the levels are maintained. And if yes, good. If it is again showing a downtrend, it has to be corrected with appropriate guidance from the doctor. Because anything that is given, it is not one-time prescription. If the doctor says that it needs to be modified as the child is growing, it has to be modified. If at all you're giving an infant dose, and if the child is grown in age and in height and weight, the small dose that you give is not enough. It is just a placebo. You are satisfied that you're giving this multivitamin supplement, but it is not enough for the growing child. So periodically having a follow up to ensure that the nutritional status, whether it is macro or micronutrient status, is well maintained, is very, very important in these category of children. So every child is different. They can actually have different kind of allergies. Therefore, so there are different kind of diets that we prescribe for patients, for children who exhibit these kind of disorders. There is something called as gluten and casein free diet, which is very commonly given. And this diet is actually helping a lot of children in having normal stools and bringing back their learning abilities to normal compared to the issues that they had. And there's some specific carbohydrate diet. These are the two commonly followed among children. I'll just take you through and tell you what are those special diets. There's something called as Gold diet. This is something, if you remember, I was telling about the dyes that are used, the food colors that are used. And there are children who actually have a lot of hyperactivity because of this. So therefore, it is very, very important that any food that is given to the child who's sensitive to the food colors has to be, taken care. No food from outside should be given to them, because most of the outside food contains food colors to make the food look more attractive. So that will actually help children in being calm, and they are able to do whatever they are supposed to perform on a daily basis for improved learning capabilities and abilities. So there are a lot of visual processing problems. They have issues with comprehension. They have issues with sleeping disturbance because of the hyperactivity that they are exhibiting. They can be dyslexia. They cannot write. They cannot sit down basically and do any activities. Therefore, Gold diet is a diet where we are eliminating all those food items which are having, a lot of colors. And at a household, definitely there will not be any food colors that are used. Therefore, this diet demands that we do not give any food from outside to the child who's having these symptoms. Then comes the gluten and casein free diet. No gluten and no dairy. So children with learning issues, and they actually have a lot of issues in digesting the gluten, which is a protein coming in from the cereal like wheat, and the casein that is coming in from milk. So this, when this doesn't get digested, this is actually leading to a lot of behavioral issues in the child. Therefore, eliminating gluten and casein from the diet is actually helping the child have a normal behavior, and then gradually they learn to manage things. So anything that is containing wheat, rye and barley and milk is a no to this child. The theory suggests incomplete digestion of this protein. Yeah, this is what I said. From protein forms peptides that may affect brain function in susceptible individuals. There are some studies that say that behavioral improvement happens. Though it is still there, it is much better. And the risk of nutrient deficiencies are also there, calcium and B vitamins, because of excluding these food items. So, whenever a child is put on a gluten free and a casein free diet, it is very important that their calcium levels are checked periodically and the vitamin B levels are checked periodically, so that at whatever level we have to start off with supplementation, that has to be initiated to ensure that all the other metabolic functions are being carried out normally. So, though this gluten and casein free diet is doing a lot of good to the child in terms of behavior and learning capabilities, it can push the child into deficiencies. Therefore, blindly, we should just not be following this diet, and whatever supplementation has to be done in the form of elemental supplementation under the guidance of the pediatrician, or we should find out the alternatives to ensure that calcium and B vitamins are supplemented in the form of food. Then comes the ketogenic diet. Ketogenic diet is the diet which is, majorly given for children who are exhibiting a lot of seizure disorders and epilepsy. So this is a diet where we are giving high fat to the child, carbohydrates are low, and moderate protein is given. Since high fat is given to the child, there can be a little bit of changes in the bowel movements, but it alters the brain energy metabolism and the neurotransmitter balance that needs to be created. That happens because of the carbohydrate that is actually not, the child is not able to metabolize, is reduced. It reduces neuroinflammation. So this, we first have to identify whether this particular carbohydrate is actually causing an issue. When you give this food, how are the epileptic episodes in the child? When you don't give, how are the epileptic episodes? Those are the small things which the caregivers and the parents have to observe, and then under the guidance of a qualified nutritionist and along with the pediatrician's consensus, this has to be followed. And there are a lot of studies which say that this ketogenic diet is not doing a lot good in terms of improving the behavioral symptoms. It is just children with epilepsy are taken care of. The number of episodes of seizures and the epileptic attacks are much lesser. So it requires strict monitoring. This is what I was telling. And risk of constipation is high because fiber and carbohydrate is less and there's more fat in the diet. There's a little dehydration and there are nutritional deficiencies because of the limited food options that are offered to the child. Then coming to hyperactivity, I was already discussing about sugar and processed foods. All these food items which contain sugar and artificial additives may help reduce. If you reduce these food items, it reduces hyperactivity. There's something called as Mediterranean diet, which is rich in omega-3 fatty acids. It contains fiber and it also contains antioxidants which supports brain function. Antioxidants in omega-3 is actually improving the learning abilities in the child, and the fiber which is introduced in the form of fruits and veggies is actually helping them have a normal bubble. So the factors which were contributing to hyperactivity in the child, that is the sugar and the processed food which contains a lot of additives and fat, since that is eliminated, the behavioral issues, the hyperactivity which the child was exhibiting is very much under control. And when I'm telling about, foods rich in omega-3 fatty acids, it can be the natural sources in the form of fish and eggs and then nuts. But if at all the child is personally allergic to these food items, elemental supplementation is also, doing a lot of benefits. Supplementing omega-3 fatty acids in the ratio omega-3 is to omega-6 has shown modest benefits in symptom reduction. But these supplements are not to be taken on the counter. It has to be under the guidance of a pediatrician itself. Then coming to the consistent meal schedules and high protein breakfast, this is also a very good thing to be introduced for a child. See, nowadays, since the schools are actually starting quite early, children are not having breakfast and they go and they eat something in the break, and immediately within another 1.5 hours, they are eating their lunch. So, this pattern is again, giving them a lot of energy in one go. So in the morning when the body is craving for energy, we have to ensure that a good breakfast is given which contains good amount of carbohydrates and good amount of protein to ensure that their learning abilities are really improved in the morning. And then whatever is the break time there, a short snack is given which is enough for the child to focus in the class for about 1.5 hours, and then the child is having a lunch break and he is eating lunch. This pattern of giving the breakfast to the child and then sending to school will also have a lot of benefits in terms of controlling the hyperactivity. And the breakfast should be high protein breakfast. It can be something like an egg white or something that is cooked with dals, and it should not be definitely all these muesli and then cornflakes and chocos. This kind of breakfast is increasing hyperactivity in children, and the milk and all that whatever is given should not have any sugar and jaggery added to it. Anything that is giving simple carbohydrates is increasing hyperactivity in children. Then comes to wheat and gluten alternatives. So now, I was telling what are the kind of diets that are available and what are, the foods that are causing issues. So now the question from the parents that, generally they listen to everything and they ask is, what should I feed my child now? So if there is no wheat, it's okay. There are a lot of other things available. So children should avoid wheat and gluten containing cereals. Therefore, rice is absolutely fine, millet is fine, quinoa is fine, sorghum is fine, amaranth is fine, and buckwheat is fine. So all this can be used as a whole grain to be replaced with wheat. The atta that is made out of all this can be used for making rotis and things. Then comes the other alternatives to the refined atta, that is maida, is corn flour, coconut flour, corn flour, almond flour, rice flour, and then the chickpea flour. So all these, rice flour, basin flour is in the kitchen at home in all the families. Corn flour is actually slowly coming in. Coconut flour and almond flour is there. It's available in the market. We just have to understand the usage and the benefits that it does to our child and then start using this. And there are a lot of gluten-free pastas available. Multigrain rotis without wheat is available. So definitely we should ensure that we will look into these options that are available and make use of it to the fullest. Then coming to the other things, definitely focus on natural things. Anything that is cooked, something that we appreciate, and that is what is giving good quality of fiber, and that is actually affecting the child in giving normal stools. So half of the behavior that is related to the constipation, and then the concentration of all these food items which are irritating him is still present in the system. So when that is out, then the behavior is very much under control. The unprocessed food is something which we have to give. And time and again, I'm emphasizing on this point that it has to be natural foods, fruits and vegetables. Fruits also can be peeled and given because of the kind of, pesticides that are used nowadays. The amount of pesticides that are added are, it is not like how it was a couple of decades back. Therefore peeling the fruit and giving is also very good. And when it comes to vegetables, if you think that raw vegetables will be very tough on the child, depending on to which age category it belongs, it can be cooked and given. Make the fruits and vegetables look more attractive. If you see there are any signs of intolerance, even fruits like apple and pear can be boiled and given. So these kind of initiatives and these kind of alternatives is adding variety to the child, and then the nutrition is taken care of. Then I was talking about the Candida diet. There are, a couple of diets that contain yeast in the that produces yeast into the intestine. That is, eliminating sugar is something which helps, and adding good bacteria, that is the probiotic, and then the fermented foods into the child's diet will help the child cope up with this. So the children who's having symptoms like toe walking, rocking, abdominal pain, and always they're complaining of bloating and abdominal rigidity, abnormal bowel movements, they have some yeast infections, rashes, mood swings. In these children, just ensure that those food items which contain a lot of sugar and those which are giving bacteria into our diet, something like bread and mushrooms, these kind of food items have to be restricted, and focus more on those foods which will actually improve the good bacteria into the gut and take care of the nutritional requirements. Then comes specific carbohydrate diet. So we were talking about the carbohydrate metabolism that gets affected in the child, which is actually exhibiting behavioral issues. So all starchy vegetables are fine. It can be included. All grains are fine, which are whole grains. It should not be polished. And dairy and legumes are fine if the child is not having any casein allergy. If at all they are having any casein allergy, then dairy also should be out. So, on taking care of these requirements of the children, we are able to help reduce symptoms in terms of constipation, diarrhea, and then the behavioral issues, the tantrums, the screaming, and the aggression and the hyperactivity that they generally exhibit. But for us to identify what kind of a diet is suitable for the children, and we should be able to assess what is actually affecting the child. So therefore it's very important that it is observed and it is documented in a diary and kept, so that when you're visiting the doctor or the caregiver or the nutritionist, you're able to refer to it and give them the correct information so that they identify what food is causing an allergy, and that can be eliminated into the diet, because elimination diet is one of the strategies which will help in eliminating all the issues causing food items from the diet, to ensure that the behavioral issues of the child is reduced, and then the learning abilities and capabilities are better. Then coming to the yeah Then coming to the deficiencies that have an impact, that is iron deficiency, which is essential for dopamine synthesis and oxygen transport. Because iron is a very, is an integral part of the micronutrient requirements, because it has a very, important function, that is maintaining the hemoglobin status in the blood. If that is well maintained, the dopamine synthesis, which is required for the normal functioning of the brain, that happens appropriately. And then the job of the blood is to ensure that it is taking oxygen to all the organs and all the cells in our body, that is taken care of efficiently. So deficiency in iron is also making the child very slow. Therefore it's very important that it is periodically checked and corrected. Then comes zinc. Zinc has the function of modulating the neurotransmitter function and fatty acid metabolism. We were talking so many things about the fatty acids, the essential fatty acids. So if zinc doesn't exist in the diet, and if there's a zinc deficiency, the neurotransmitter function that has to happen normally, that is not happening. That also can be leading to hyperactivity in children, because the fatty acid which is already present is not available to the child. So therefore, this is leading to hyperactivity. Then comes omega-3 fatty acids. It is very crucial for neuronal membrane fluidity and signaling. That is why when there is omega 3 fatty acid deficiency, the child is not able to react the way the child should when somebody is talking or somebody is calling out the name. So it is very important that the micronutrient status is checked periodically and corrected if needed. Then comes vitamin D. It has the property of mood regulation and maintaining immune health. So generally, when we see that the child is falling sick very frequently, it is very important that vitamin D status is checked. And nowadays, vitamin D and vitamin B12 is requested by the doctor whenever we go for any health checks. That is because of this reason. It is irrespective of the age category. It takes care of the mood regulation and immune health in adults also. And low levels of vitamin D is also worsening the symptoms in ASD and ADHD children. I was talking about the gut brain axis. The gut and brain communicates bidirectionally via the vagus nerve. If you just see the picture, via the vagus nerve and immune pathways and microbial metabolites. That is why they say whatever happens in the gut, it has an impact to the brain, and whatever functions that the brain controls, it is having an impact on the gut. So if the gut brain communication is maintained well, then the homeostasis that is needed to be maintained within an individual is well maintained. So that will have an impact on maintaining sound health and also take care of normal behavior in children. Therefore, probiotics and prebiotics will help regulate mood, behavior, and digestion. Because when this gut brain axis get affected, there's a lot of dysbiosis that happens in the gut. The normal atmosphere that has to be maintained within the gut, that is not there. It disrupts the normal functioning, that is dysbiosis, and that can be brought back with probiotics and prebiotics in the diet. The good source of probiotics is the normal thing that the regular thing that we eat on a daily basis: yogurt and curd and buttermilk. And prebiotics is fruits and vegetables. If this the child is able to manage, if there is any specific allergy that the child has, just eliminate that and give whatever the child is able to tolerate, and that will take care of the gut brain communication in a normal manner. There is normal functioning of the gut, which is having a good impact on the brain function. And there are a lot of studies that say that there's a strong link between gut and brain, which will help in maintaining, you know, there is no inflammation in the body. There's no inflammation in the brain. So it reduces the neuroinflammation episodes in the brain, and it maintains normal homeostasis in the gut, which is taking care of the growth and developmental milestones and also the learning abilities in the child. So gluten and casein free we've already discussed, and I was telling something about elimination diet. So any particular food that is actually triggering, the symptoms in behavioral issues, children, also in hyperactivity, just eliminate that food and see how the behavior is. And maintaining a diary, maintaining a journal is very important. Focus on whole foods, unprocessed foods we've discussed, and micronutrient supplementation is zinc, magnesium, and vitamin B12. I have already emphasized on that. Since most of the food items the child is not tolerant to, it's very important that elemental supplementation happens. Then comes what are the preventive strategies that the children are born with these kind of special needs. So maternal nutrition during pregnancy is also very, very, very important, which influences the brain development of the child when it was in the fetal state. Then adequate amount of folic acid and omega 3 and iron and iodine is essential. And when the child is born, breastfeeding is something very, very important to ensure that the immunity is maintained. And then the neurological development, which has happened in the womb when the child was in a fetal state, it continues for some time after it is, out, and then getting used to the environment outside, and avoid early exposure to highly processed foods and additives. See, nowadays, is a trend of eating a lot of processed food and eating out whenever it is a holiday or it is a weekend. That should be kept away from a child who's just born and who's just getting used to the external environment. And then regular monitoring of weight, growth, nutritional markers in risk children can enable early intervention. This is what I was telling from the beginning, that periodically getting the health check and keeping a check on the growth milestones of the child and observe what is happening to it when he's eating certain kind of food items outside and at home is very, very important. And what is the role of nutritional professionals? When I said qualified people, I was just trying to say, see, how authentic the individual is whenever you're reaching out to somebody online or you're going to a clinic nearby. Ensure that qualified person, so that the insights that you get from them is actually making the life you know more comfortable for the child who's battling with a lot of issues. It can be the learning issues, or it can be managing with the physiological issues like abdominal pain and constipation and diarrhea and things. And behavioral feeding therapy helps manage picky eating. This is what I was telling. Playing with food is something, it's very important to ensure that the child starts liking that food, and he will be able to manage his likes and dislikes later in life too. And parents require structured guidance. See, parents generally are not aware about many things, so it's very important that when you identify there is some issue, you go to the proper person who's able to help you to learn how to overcome these issues in your child, and you're able to make your life more pleasant and stress free. And coordinating with pediatricians, psychologists, occupational therapists enhances the treatment outcome. The practical tips for managing behavioral issues is alternate diets and meal planning. Rotate grains. Do not keep giving the same kind of food. Try and include all legumes. Try and change the preparation so that the child will not be able to predict that this is the taste and he is refusing to eat. Then ensure adequate intake from fortified plant milks. This is like whenever some child is having casein allergy, the other plant-based milk is something which you can give, that is soy milk, rice milk, almond milk, and things, and leafy greens or supplements. And the most important thing is reading the label when you're giving anything that is processed. There can be hidden gluten and casein in processed food items, so it is very important that you read the label, and you're going to work with the dietitian to prevent nutritional gaps and support adherence. This is a picture of a cyclic menu. So whatever the child likes and whatever the child tolerates, make a list of that and make a cyclic menu for a week and follow that, and use the same ingredients but change the preparation. By doing this, you're adding a lot of variety into the diet. The child will appreciate the preparation, and he might start liking those foods which he was refusing to eat. So this is just, on a lighter note. Anything that is yum and the child tolerates, please go ahead with this. And anything the child doesn't tolerate, ensure that you use that.
ఫైనాన్స్ వాళ్ళే ఉన్నా చిట్ ఫండ్
Yeah.
వాళ్ళకి
And then another question, are grains good? And the answer to it is yes. If you eliminate all that which is with the child is allergic to, then grains are definitely good, because they are the major sources of providing energy to the body. And it is also taking care of B complex vitamins and iron, which is required for maintaining the energy levels, maintaining bones, and also the immune system. When you are eating grains, it's not only providing energy, it is taking care of the immune system if you're eating grains in the adequate quantity. So if you're not eating grains, that means you're deprived of energy and your immune system doesn't function properly. Therefore, it's very important that if not wheat, there are a lot of other things available. Use that appropriately to ensure that the energy levels, the bone system, the and then the immune system is functioning appropriately in your kid. Fruits and vegetables in plenty. So eating a lot of fruits and vegetables and micronutrients is giving a lot of antioxidants, which is keeping us away from chronic diseases like cancer and type 2 diabetes. Therefore, it's very important if the child is allergic to something, use another alternative which he likes and which is actually in the natural form. That will take care of weight, that will take care of cholesterol issues, and that will take care in preventing constipation. So whatever you feed the child in the infant stage, he or she will develop taste to that particular food item because he is used to that. So therefore, it's very important that introducing fruits and vegetables into the child's diet is very, very crucial in the initial days when you start the child, on weaning food items. So this is something, about cereals and grains, almond flour and psyllium husk and chia seeds, coconut flour, flaxseed meal and things. There are a lot of items available. Earlier, we used to have something called as a brand Nature's Basket from Godrej. They used to have a lot of stuff, but now, there are a lot of other brands that have come up. The only thing that is needed is to ensure that this is very important. I wanted to just reading the label. Read the label. The ingredients are listed in the order by weight from most to least. Anything that contains maximum comes on the top of the list. So read whether it contains anything that can affect your child whenever you're buying something directly from the market or whenever you're buying something as an alternative to the cereals and grains. Then moving on to, this is a very nice slide that I wanted to show. Protein is actually important. I've been, emphasizing on that point. All grains and milk and meat and poultry and eggs can be used until and unless the child is allergic to that. If he's allergic, then eliminate that. Protein rich foods are taking care of a lot of micronutrient requirements that we have. It can be vitamin A, B, B2, E, K, C. So try and improve the colors and the composition of the diet in terms of adding variety that will take care of all the requirements for protein and immune system and to maintain the fatty acid status in the body. Dairy, as mentioned, if the child is allergic to casein, then switch to all these other alternatives that are available in the market. Coconut, almond milk, rice milk. Lean meats, ensure that non-veg is cooked at home and it is fed to the child. Use less oil and keep away all red meat like, red meat like lamb and beef and things. Slim it and then use it. Remove the skin from the poultry, and if at all dried non-veg is an option, wash it thoroughly to ensure that all the sodium and the salt is out and then it can be used in cooking. But processed meat should be used in moderation, like sausages, salmon and deli meats and things. This is, coming to the serving size recommendation for age. So when it is grains, vegetables, fruits, dairy, and protein, every age category has a specific requirement. If the child is 2 to 3 years old, 4 to 5 years old, 6 to 8 years old, 9 to 17, and 18 plus, as they are growing older, their requirements change. This slide is actually giving us an insight about that. 3 ounces when it is 2 to 3 years, when we are focusing on grains, then it becomes five, then five, and then six. Vegetables, 1/3 cup, half cup, 2 cups, 2.5 cups, and 2.5 cups. Fruits, again, 1/3, half, 1.5, 1.5, and two. Dairy, if you see, it's 2 cups, 2.5, 2.5, three, and three. Protein, again, it increases. 2 ounces, three, it becomes at 4 to 5 years, and it becomes 5 at 6 to 8 years. It remains the same, but up to 17, and then it increases when it is 18 plus. And then the other nutrients, go for fortified milk and things like, all this tetra packets of milk that is available, all those will be fortified. That will take care of vitamin D and calcium. And when it is iron deficiency, along with the supplementation given by the doctor, focus on these food items. I was just telling that red meat for a growing child to correct iron is fine, but there should be a limit on the quantity and the frequency. Then coming to the dry fruits like prunes and raisins and spinach can be used. Egg yolk can be given if the child is not having allergy. If at all there's a specific allergy that should be avoided. Then nuts can be given, lean meat and beans and peanuts. There are a lot of allergies that are seen in children when it comes to peanuts and eggs and nuts. So those children who are allergic to this, then they should get protein from the other sources, or there can be supplements that are recommended by the dietitian that should be followed. And fiber in the form of whole grains and fruits and vegetables. This I've already discussed. Therefore, there was a mention of the support group. So the pediatrician, dietitian or the nutritionist, occupational therapist, family members, and the caregivers are the ones who are falling into the support category to help the child cope up with these issues. Therefore, whatever is the follow-up recommended, that should be, maintained. So how do we support? Be clear and predictable. Allow processing time to the child when you're talking. Do not be in a hurry. Let the child understand and then act on it. Use clear and simple language. Avoid ambiguity and humor. Give him time and space. Let him behave in a comfortable manner. Maintain a routine. It might be a little difficult because they don't listen, they stick to their routine and they are rigid, but try and bring him or her back to the routine. Then acknowledge social differences that they have and do not be very rigid. Learn to live with them and accept their behavior, and that will help them in coping up, and they feel that they are, accepted by the community. So that is very, very important. Accepting and including them within the community is something which is very, very important. With this, I end my talk. Thank you so much for the attention.